Paige has spotted somebody who had just recently been pulled out of the water. She is now going to check her surroundings and then run over to the person and see if they're okay.
Are you okay? Are you okay?
She's then trying to check for a response by gently shaking them. After this, she is going to call 911. Now we're going to talk about rescue breaths. This is when the person is not breathing, but there's still a pulse. First, you're going to pinch the nose. Then you're going to cover the mouth with yours completely to seal it tightly. After, you will begin one breath every 6 seconds for an entire minute. This will give you about 10 breaths in total. You're going to watch for the chest to rise and fall as the air is going into the mouth. Paige has just recently contacted 911. Now, until they arrive, she is going to proceed in doing her rescue breaths. First, she's going to pinch the nose of the patient, tilt their head up to open the airways, and she's going to begin the breaths one every 6 seconds, giving her about 10 breaths and making sure to watch for the chest to rise.
1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6.
Julie's grandpa has just had a heart attack. He is now on the floor and he's not breathing and there's no pulse. She's gonna first check her surroundings. Now she's going to look for a response and shake him lightly. You okay? And also ask if he's okay. Now she's going to call for help, aka 911. 911. And now she's going to wait until they arrive. Now we're going to talk about CPR. This occurs when the person's not breathing and there's no pulse. Now, first you're going to, after checking for your surroundings and calling for 911, you're going to then start out with 2 breaths first before you begin your compressions. First, you're going to pinch the nose and tilt the mouth up to open up the airways, and then you're going to start with 2 breaths first before the compressions, and you do 1 breath every second. So you're going to take the heel of both palms, or the heel of one palm, using your dominant hand over the other, and you're going to make sure you're pressing into them 2 inches deep for 30 compressions. And then after your 30 compressions, you do your 2 breaths, and you continue this for about 5 cycles. Julie has just recently found her grandpa on the floor. He is non-responsive, and he does not have a pulse. Now, after calling for 911, she's then going to begin her CPR. First, she's going to pinch the nose, tilt him up so she can open the airways, and she's going to start out with her 2 breaths, 1 for each second. Then she's going to lock out her arms, interlace her fingers, and use the palm of her hand and press 2 inches deep into his chest and begin her compressions of 30.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10 and 11 and 12 and 15 and 14 and 15 and 16 and 17 and 18 and 19 and 20, 21, 22 and 23 and 24 and 25 and 26 and 27, 28, 29, and 30.
She's then going to do her 2 breaths once again and repeat her compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now we're going to talk about conscious choking. Conscious choking is when the person is conscious but they're choking and they can't breathe out of their airways. So first, they're going to make the universal sign for choking, which is this. And you will ask them, are you choking? And then they will nod. And then you say, I can help you, can I help you? Then you will take them and you will slightly bend them over with your left hand or your dominant hand in front of them and your palm of your hand, and you're going to do 5 back blows between the scapulas. Then you will change positions and you'll have an L shape with your feet, and you'll have your right hand over and then your left hand over with your thumb facing inward, right above their belly button. You will do 5 abdominal thrusts. And if that doesn't work, you will repeat that again until the thing lodged between their throat is out. Are you choking? I can help you. Can I help you? Unconscious choking is when the person is not able to respond and is no longer breathing or conscious. First, you will slide them down carefully down your leg and onto the floor. Then you will check your for ABCs, and after that, you will call 911. Then you will begin your compressions from 30 to 2. First, you will do 2 breaths, and then you start your 30 compressions, and if the food is closer to the top of the mouth, you will then do a finger sweep with your pinky, scooping up the food. If you cannot get the food in time, then you will start your 30 compressions once more. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.